Good evening, everyone, and it's really nice that. Just a minute, I'm not finding my PPT. J1. Okay. Okay, you are changing. Okay, fine, great. So, good evening, everyone, and thank you very much, AIOS and Women Ophthalmology Society, to give me this opportunity to present my topic on my experience in international fellowship. I have done my glaucoma fellowship from University of Toronto, Canada. And because I have done long-term fellowship, it is more relevant for immediate fresh pass out MS or DNB students, because long-term may be a challenge for going after your busy practice. So let's the first question that I get from the resident doctors is: international fellowship required? So for that thing, I have a question. Do you know the conjugates of people, company, language when not ready to explore beyond their comfort zone? We all know what Nokia mobile went through. So my answer will be: leaving the comfort zone in every way possible is the best part of international fellowship. There are multiple limitations, of course, the financial, however, it can be handled by scholarship through international or national merit, any sponsorship program, or definitely through family also possible. Being personal, many questions come like: if you are married, if you have kids, is it possible? Yes, of course. I went for my fellowship when my daughter was 2.5 years old, and she was with me throughout my fellowship. Climatic condition, we have to adjust. For the food, please try to explore. Thanks to Indian food industry entrepreneurs, they are present everywhere. And cost cutting and maximizing time must be a habit to handle. These are the opportunities that we will will get it. The question is how much we are utilizing it. We may use this an opportunity to settle abroad, but be prepared to do their post-graduation. Without that, it is difficult to get consultancy. If we are planning to implement our experience just back home, please utilize the utilization of your holiday 2 days per week, that's Saturday and Sunday. To increase your efficiency, it will give you a habit of to realize the impact of quality life and work in your outcome. Utilization of your mandatory research day, out of 5 days, 1 day is going to be research day, that should be utilized, and utilization of your 1 hour of lunch break, and utilization of laser day. Pre-planning and fixing high demanding observership, like I have done my observership with Dr. Aik Ahmed when I was doing my fellowship with Dr. Trope and Dr. Bias. Utilization of your culture and spirituality to create strong and long-term networks. Notice the positive work and academic cultures and its long-term impact. Notice the success of conference without food also. And utilize your ID to explore the process of record keeping, because you can go into everything, and ongoing training options in other department, and of course it enhances your resilience. So the $1 million question comes to me: do you get enough surgery? What is the target of a surgeon? To count the numbers, or to get enough confidence to handle unavoidable complications, enough understanding to avoid preventable complication? So best thing is utilize your wet lab to satisfy your number counts, because you actually get human eyes when during our training that time in the wet lab also. So these are the FAQs. When should I start preparing? From the as our esteemed panelists have already mentioned, from the first year, because we have to go through the FICO. If you have, it gives a lot of, because I had FICO, it was my positive impact when I went through interview immediately after my post-graduation. So additional exam apart from FICO, FRCS we can give, after the second part, last part we will give after 5 years of experience, as already mentioned by my previous speaker. So research papers as much possible. And do you need to be intelligent? Rather, I will feel that you should have clarity of your thoughts. So I have, because I have to emphasize on Canada options. So these are University of Toronto options possible. All you will say of kind of 1 year, 2 year, 1 year is quite sufficient. and you will quite go through multiple things. 2 years is your and mentor's choice. This is University of British Columbia. And then comes the University of Alberta. These are all available in the net. So University of Calgary becomes a challenge because of the climatic condition. University of Manitoba, McMaster University, and University of Waterloo is very popular university and nice one also. Queen's University, Ottawa is the capital city of Toronto, as Canada. So however, the language is Spanish, so we have to learn that. So University of Ottawa, University of McGill, Dalhousie University, University of Montreal, the same thing that we have to go through, French language you have to learn. And then comes, these are all the references from where we can get all these details. So coming to the point at my journey back home, so can I contribute for my next generation? So with that thought, actually, Dr. Anjana ma'am already mentioned that I started Advait India Foundation. And even I have developed a training center, whatever best I can do, and for which I show my gratitude to my mentor, Dr. Satveer Singh, who was my guide during post-graduation, and he was himself trained from Wills Eye Hospital. Because of that, he used to mentor us and give the vision that to proceed ahead for international experience. So in his name we have just launched recently the international fellowship sponsorship or scholarship program. So you can visit through advait.org. And I would like to thank my Dr. Trope and Dr. Bias, my mentor from Canada, who are ready to be in the selection board so that it will be non-biased and completely fair. And of course, Major General Dr. Avijit Chakrabarti, who was head of AFMC Pune, to make sure that the candidate will come back and give back to the society as a mentor to the next generation. Thank you very much. I look forward that a lot of international presentation will happen from India. Thank you very much.